And yeah, thanks for like filling out the poll, everyone. It's really interesting to see too that it seems like a lot of people have experience with mindfulness, and then um, a little less with CBT, and then ACT is something that people haven't had a lot of experience with. So we hope that it'll be interesting to hear more about these today, and also to hear what it's like for us to adapt them. So now we're each going to give kind of an overview of each therapy and then how we adapted it. And then we'll go through some questions that we prepared, and then we'll do a Q&A at the end. So first, Domenica and I will talk about CBT. So Domenica, do you want to give a sort of overview of what CBT is, and then I'll talk about how we adapted it?
Sure. Thanks so much, Hannah. Hi, everyone. It's such a pleasure to be here today. Thanks for having us. So, in terms of CBT, from that clinical perspective, what is it? What does it look like? So, CBT is known as Cognitive Behavioral Therapy, which is a type of psychotherapy or talk therapy that's used to help us when it comes to managing certain mental health conditions, maybe such as depression or anxiety, and it helps us look at actually breaking it down. It looks at our thoughts, behaviors, and our emotions or feelings and moods. And so it looks at how they all intertwine and how they can all interact. But CBT itself tends to be more of a structured approach. That tends to look at our thoughts and cognitions and focuses more on kind of the present moment of what's going on with these thoughts or quote unquote unhelpful thoughts, and how does that impact or um, kind of speak to what our behaviors are and why we might act in certain ways.
Yeah, thanks, Domenica. So
Thank you too.
we adapted it by basically our process of adapting it. So I know people are talking in the chat about CBT and how sometimes it doesn't work very well for autistic people. And kind of one thing that we did was sort of looking through, because I'm autistic myself, so we kind of looked through it and sort of identified things that I felt could be missing in it, or maybe could be not accessible to autistic people. So putting things into do a lot of validation over like when someone is, and I think this was already a big part of the group, but just making sure to like validate that people's anxieties come from like real experiences, and to making sure that that's a really key part of it, so that people feel like that these experiences are like understood, and that like they can both work on having more nuance in your anxieties, but also and worries, but also like um, knowing that like they are there for a reason, and so kind of keeping those that balance there. And then also kind of making like making adaptations to like worksheets and things like that, providing them in different formats, being more accessible to things like demand avoidance of like how people might feel about filling out a worksheet or doing homework and things like that. So those are just some examples of things that we did and how we adapted it. And then yeah, Sue and Jan will talk about our mindfulness group.
Amazing. And Jan and I have been working together so long doing this. Or we're going to tag team, Jan?
Yeah, sounds good. Maybe you could provide a little bit of an overview of mindfulness and I can maybe help out on the ways that we've been adapting it, the program. How's
I
that sound?
love it.
Okay, cool.
I love it. And really appreciating the incredible questions in the chat. Somebody mentioned already one of the big things we talk about and why it's important to adapt mindfulness. And people are talking about interoceptive and emotional processing, a lot of things we give a lot of attention to in the mindfulness program. So in short, mindfulness is, as many of you know, we saw in the chat that lots of people have participated in it. Mindfulness is a set of tools and a pathway to exploring self-awareness in regards to the way we are in the world in terms of our emotional understanding, self-regulation, and just an all-around path to exist in the world. So with the mindfulness tools come a set of experiential meditation practices that involve feeling the body and speaks directly to what we're hearing already from participants around the interoceptive things that come out, especially in the autistic population. So I'm a mindfulness teacher with over 40 years of practicing in traditional ways. I have seen mindfulness harm many, many, many people in trauma settings and in neurodiversity settings. So when I found out that Yona Lunsky wanted to adapt mindfulness, I was so excited. And we immediately engaged the team behind Autism Goggles, which is Daniel Scherstrom, autistic young man, and his mom, also autistic, Maxine Scher, and started exploring. And they both had practices in mindfulness before. So we started exploring what would be some fantastic ways of adapting and modifying. And then Jan came on for the biggest part of our work. Do you want to talk a bit about that and the other adaptations, Jan?
Yeah, for sure. So yeah, I sort of jumped on when we were launching a lot of the virtual practices, and then most recently we've been doing more in person. I think we started with some in person groups as well. So yeah, it's been sort of this like nice lineage of like having all these different autistic advisors, including myself, getting to collaborate and bring in different insight. I think that's always really important because everyone's going to have unique perspectives, and just a lot to offer, which I felt like it's really contributed to a lot of these meaningful changes to the programs and adaptations over the years. Other things that we did too, I think, like when we were with the program, there was things like offering regular checkups or check-ins with people, like having like not like during the sessions, but then if people wanted to do like a one-on-one, we always felt like that was something that allowed people to maybe, if they wanted clarification, that was always something that we were able to offer. A couple of the things that were important was just offering variety. So having flexibility and choice in mind, knowing that not every exercise or practice is going to resonate. So a lot of the time, rather than maybe doing one practice for one specific task, or goal in mind, we would offer a few different ones and maybe acknowledge and then maybe check in like which one resonated the most with you, sort of acknowledging that everyone is going to have different social and sensory processing preferences. So we found that was something that was really important. There was a lot of flexibility too in terms of like, I think with our in-person group, offering some flexible spaces where if people needed to, maybe go to another room or just have that ability to go to somewhere that was maybe more sensory friendly. That was a big component. When it came to the actual practices themselves, we adjusted the lighting based on preferences or offered a variety of different spots to sit. If you wanted to sit or stand or maybe lay down somewhere. So just sort of incorporating some of those aspects, more like building in some regular rest times and opportunities for people to connect in the groups, because we felt like the community connectedness was a really important facet of mindfulness as well. And we did our best as well to sort of acknowledge everyone's different communication preferences. So some people, especially when we're doing virtual options, like some people might not feel comfortable engaging, with the camera on. So maybe there would be like you could use the chat functions or using emojis and different ways to sort of connect with each other. And then I think we were very much about just acknowledging everyone's diversity and their preferences throughout the process. So people felt like they could be themselves and they could unmask and feel comfortable within this particular setting. So those are a few things that we sort of adapted. Anything else coming to mind, Sue?
I think we're covering it. I mean, we could talk for hours, but I think we're covering a lot. Thank that you outlined that really beautifully, Jan. Thanks.
Yeah, and then Alex and Braxton will talk about the ACT group.
Oh, good. Thanks, Hannah, and it's great to be with you all today. It was actually really fascinating to hear how mindfulness had developed. I didn't know all of that. I think we'll talk a little bit about ACT. ACT is a little bit newer to our service at ANS, and I think it's newer to all of you as well. So we're all kind of discovering it together. Actually, there had been an ACT for Caregivers group as part of our program for a while now. And I think I saw Lee on the call somewhere. So she was one of the people that was instrumental in making that happen. So what we decided was that we wanted to have an ACT for autistic people group as well. And so unlike maybe, most of the things that we've done in ANS, from the very beginning, we had autistic people's inputs on how we should develop this program. Oh, am I muted? I think people can hear me, right? Okay, yeah, I think most people can hear me, so I'll just keep going, sorry. So we had autistic people from the very beginning in the co-development phase. We used a lot of materials from the Caregivers program as well. But some of you are probably wondering what ACT is, and so I'll tell you a little bit about that. ACT is a little bit different than CBT and most other kinds of therapy, in that most other kinds of therapy have the starting point that there is something wrong, or that there's something that we're trying to fix. And ACT has a different kind of perspective on that, in that we are all human, we're all suffering in some way, and some of that suffering comes from our efforts to try to avoid painful thoughts, painful emotions that we have. And so ACT really wants to refocus us on this idea of psychological flexibility, that that we can learn to think about our thoughts, we can learn to think about our internal experiences in a different way, with ACT's version of acceptance. And what we can then do is we can commit to things that are important to us. So what ACT calls values. We can take actions that help us to move towards our values. And in doing that, we live more meaningful lives, rather than, explicitly trying to reduce anxiety or depression or something like that. And so ACT has been used for a while. It's not new to the world, to the therapy world. And it's been effective for a lot of people with anxiety, depression, other kinds of mental health concerns. But we, again, wanted to develop this whole program with autistic people from the beginning. So I think Braxton maybe can talk a little bit about the adaptations we've made. But I think Braxton's camera cut. So are you still here, Braxton? Maybe not. Maybe I can talk about it as well. Jan actually was also one of the autistic co-facilitators of ACT. And so, Jan, if you have anything to add, you can as well. But I think a lot of the adaptations that we made are similar to the kinds that we made in CBT and mindfulness. ACT really has a heavy focus on metaphor. And for some autistic people, the metaphors really work, and for some, they don't. And so, like some of the other programs that we've done, we've really tried to make changes, giving a lot of variety to people. So we've taken this kind of approach where we say, let's try this exercise. We can try it a few different ways, and there might be a way that works for you, and there might be a way that doesn't work for you. And instead of kind of getting focused on just trying to do something in one way and then having that not work, we've tried to have a variety of approaches. We've tried to do the same things as the other groups as well, in that we've given lots of visual materials. For some people, that's a great adjunct. For some people, that's necessary for them to engage with the material. And in all of our ACT groups so far, we've always had an autistic person co-facilitating. We're just on the second one ever, by the way. That's me and Jan are co-facilitating that one. And Braxton's about to start our third ever one pretty soon. Sorry, I know you're probably not ready for this, Jan, but anything else to... Oh, Braxton, are you back? I can't hear Braxton.
Braxton, you're muted. I think that someone will need to unmute you, Jan or Alexa.
Hello, sorry about
that.
Great.
Hi.
Technical difficulties, but I'm back again.
That's okay. Glad to have you back. Poor timing, but yeah, obviously nothing we can do about that. Braxton, did you want to add anything in terms of adaptations that we've made for ACT?
So I'm not sure exactly where we left off before I fortunately started experiencing some technical difficulties. But I think that one of the wonderful things about ACT is I think it's sort of often considered a third wave type of CBT, because I think with typical CBT, it's very structured and rigorous to the point that sometimes it can feel alienating, especially for people who are neurodiverse. And I think that, part of what we did in terms of trying to modify it was just, I think, when you're autistic, you sort of are navigating a world that feels like it was designed for someone else, right? Someone who's more sensory tolerant or socially fluent, or just able to follow these sort of secret unspoken rules that are in the world all around us. And so we sort of, for me at least, sort of grow up feeling either like we're too much or not enough. And so I think that because in mainstream settings, we're sort of just constantly expected to conform to these neurotypical standards just in order to participate, I think having a space where we don't need to mask, just, where we know that it was designed from the ground up by autistic people for autistic people, I think that can just be incredibly validating and just even sort of from the get-go, sort of a priori, it can create an environment that's more conducive to sort of therapy and, you know, beneficial therapeutic relationship just by having that sort of groundwork there. But, you know, of course, even within autism and autistic spaces, there's huge diversity in terms of different sensory needs and, you know, processing speeds and communication preferences and ability, you know, and that's before we even get into things like intersectional identities and, you know, other things that people may often have going on. So it's sort of, you know, we didn't just want to say this group is for autistic people and call it done, right? You want to really adapt these groups to meet people where they are, and not, you know, I think the view we're taking is not necessarily adapted as accommodating a deficit, but rather designing for, you know, access and dignity and full participation. And I think that that's really where the role of the autistic co-designers and co-facilitators comes in. So hopefully I didn't sort of just go over too much what Alex already said, but
No, that was great.
Yeah, thanks everyone. And so now we just have a few questions that we prepared to answer, to just share more about why all of this is important to us. And then we'll do a Q&A in the last 10 minutes. So I'll put the first question in the chat, which is, yeah, why is it important to have these groups for autistic people, and why is it important to adopt them? And we kind of already like answered this a little bit, but if anyone has anything else to say about that. Like Braxton was saying, one reason why it's important to have these groups that are specific to autistic people is just for like the validation and the community. Like it's nice for people to be in spaces where everyone is autistic and they can see that other people are dealing with the same things they are. And that can be a really powerful thing for people and really helpful. And it's not just about learning, it's not just about developing these skills and learning the therapies, but it's also like the community support and going through this together and working through this together, and people sharing something that they're struggling with and hearing that someone else struggles with the same thing, and that's a really powerful connection.
I'd also like to share as well that I think it's super important to have these groups designed and developed for autistic people and from autistic people as well, because even when it comes to certain psychotherapies, we'll use CBT, for example, it's known in its history to be so structured. And I think what's beautiful is when we actually break this down and then learn more from an autistic person of what we can do to help adapt it, it then becomes, in a way, unstructured to the point where we can now use this and be able to provide it to other populations that may have had difficulty with it otherwise. And I think it's just so beautiful to be able to learn and work alongside Hannah as well, to be able to, I would say for myself, become a better clinician when working with autistic adults. And I love to share that I become better in working with the population because I learn from you as an expert on yourself and who you are. And this helps to then learn about these unique differences that each person has, and we can then apply this in our clinical setting as well. So I think it's super important, and glad that we get to adapt this in our area.
Yeah, thanks, Domenica. And I really enjoyed the opportunity to just like work with clinicians and like how like all of our ideas come together, and just like just chatting about things and adapting it together. The conversations we have are really great, and that having that be this like ongoing process.
And I don't know, maybe I can speak on the sort of the mindfulness sort of approach. Yeah, I think it's important, because I think, you know, like when we're prioritizing things like safety, connection, trust, you know, people feel like their needs are being met and they're being acknowledged and they're being recognized. And in that, like, you know, it makes the practices feel like they're much more inclusive, and, you know, people are able to be themselves, to you know, engage in things that feel like they're sustainable, and they apply. It's not just I'm doing this, I'm going through the motions, but to have something that really resonates with them and what they're experiencing. So I think that when we're making these practices, you know, neuro-affirming, it's, you know, people feel seen and supported, and I think it fosters sort of this long-term engagement. It's not just, you know, I did the program and then it sort of falls by the wayside, but I think it's sort of it's something that I think people feel like they can stick with, and it's something that's going to have a positive impact, and it's not pathologizing or you know, neglecting some of the structural barriers that a lot of people are facing in daily life. So people are walking away, at least what I've been noticing, having done, you know, both the mindfulness and the ACT groups, is that people feel like they're walking away and they feel like they're able to connect with people, and they're able to have some tools and resources that they want to keep building on, and like there is sort of this desire to keep, like, you know, learning more afterwards, and not feeling like I'm going to walk away from this and then I don't ever want to kind of go into a therapeutic setting again, which I've heard from a lot of people. Like they might have a bad experience and then they're reluctant to, you know, proceed in the future. So I think it's important to you know, go about it in this way, as we've been discussing.
And I also love to, just to jump on with you on, I also love how we're talking about the importance of learning. And I like this term, like in some of the groups that the Azrieli Center does, there's this thing called all teach, all learn. But I love how whenever we do a mindfulness exercise, we don't just teach it in the one standard way that the standard mindfulness curriculums have. Is like there's one way you do it and that's it. You feel your breath. We know that that can cause panic in a lot of people. So we provide a menu of options engaging in different senses, depending on where you're at individually. And we really celebrate everybody's individual way of connecting with mindfulness tools, and then have a discussion. And then we'll learn from other people. And it's really cool seeing all the autistic adults swapping notes and really finding a sense of home. We had one person do a group with us, and Jan and Domenica, you'll remember this, that person said, and that they said, I do a lot of groups, and this is the first time I ever felt like I belong. Is that what they said? Was it I belong? Yeah, Domenica's nodding there. Yeah. So, you know, just I think having that safe, like really emphasizing this is a safe space, and whatever you need, we're going to work to. And I love how Braxton was talking about access needs, right? We're going to make this a space for you, whatever it is that you need. We're going to, you know, we have to adapt the world, and the world has to learn from this community, right? Because we still have a lot more that the world can learn to be a little bit more affirming and inclusive. So this is a wonderful discussion, and everybody here's got such great stuff to add. Thank you. And your chat comments are amazing. Can't wait for the Q&A.
I might go ahead and put the next question in the chat, which is, what is the role of co-facilitators with lived experience in making groups more neuro-affirming? And if we already covered this, we don't need to talk too much more about it, whether if there's anything else people wanted to add. I think like it's really important to just adds to people feeling seen and understood, like knowing that there's someone there who's autistic and who's involved in the group. I think also like yeah, it can help them feel that everyone is very neurodiversity affirming, because they can see that autistic people are like, yeah, are experts along with clinicians, and that this is a space where autistic people are not only clients or patients, but they are like involved in providing the support, and they're involved in creating the supports, and that really like is very neurodiversity affirming, just like structurally, of just knowing that autistic people are not only here as clients, but we're here designing the programming, and we work here too.
Yeah, I guess just building on that too, I think in terms of like what I've been noticing is I feel like people feel like when there's a relatability, I think that people are coming together and like sharing. It's interesting because like sometimes like we're learning so much as well from the people who are participating. Like they're sort of like we're getting this expertise, and sometimes we're sitting there and like, if a particular exercise or practice isn't maybe working or resonating, like coming together and having other people kind of talking about how they might have adapted something, or there's sort of the shared problem solving can be really, really empowering. And like we like to take that advice and, and incorporate that, because we want it to be as impactful as we can make it. And I think that's sort of the way that we've been designing things in that process. I think that it definitely is, there's that openness to receiving that information, that feedback. And I think that because that's our goal from the onset, like we want to keep improving the practices over time and adapting them. And yeah, it just seems like by doing that, people just feel like, yeah, like they're in a space where people are like their opinions matter, their insight matters, and we're taking it, and we're I guess it just ends up becoming this really mutually beneficial, engagement. And I think that people feel like they're able to connect in really meaningful ways. Like your voices matter and your opinions matter, and I've just seen it have a really profound effect on like everyone's sense of connectedness afterwards. Like people are walking away and being like, wow, like people were really supportive, and like everyone was really looking to make the experiences the best as possible, which is really nice to see.
And I think in my experience as well, this sort of the role of the co-facilitators and having those co-facilitators who are autistic is that it can also sort of shift the structural power dynamics inside the group. I think having co-facilitators who have lived, what the group members are living, really transforms that dynamic. And it's not just about representation, although, of course, representation matters, but it's also about changing the sort of structure of the group from it being sort of expert versus client to instead being peer alongside peer, right? So it's not something that's being done to autistic people, but rather it's something that's sort of built by and for autistic people. And I think also having that lived experience as an autistic person, I think that sort of gives you a depth of understanding that you can't necessarily get from textbooks or training seminars or university courses. And you can sort of maybe spot the unspoken, when someone is overwhelmed, but maybe masking. It's a little bit easier to see that when you have that experience yourself of knowing what that's like. And I think it also gives you the ability to sort of model authenticity as an autistic person, not just coping strategies, but sort of how to live authentically. And I think because it's not just that professionals helping clients dynamic, but rather it's sort of autistic people creating space with one another. It really helps people be more open and vulnerable, especially people who have had in the past negative experiences with therapy, and people who are maybe, they have some trauma associated with that. They really, after a couple of sessions, at least in our group, really opened up, and just, watching the transformation of people from, being really sort of closed and nervous at the beginning to being so open and, willing to be emotionally vulnerable with other people in the group, with their peers and with us facilitators, is really, it's really just amazing to see. And I think it just changes the tone of everything, because we're just saying, you belong here exactly as you are, and you can feel free to be your authentic self. And so, I think we got a lot of amazing feedback at the end from the clients saying this was amazing, and we loved the environment that was created by having the co-facilitators there. So I do think that it's a really beneficial piece, and it's not just about representation. I think it's about sort of changing the entire dynamic of the group.
I just want to share, Braxton, that was so eloquently shared. I so admire really what you shared, and thank you for bringing this all up to like our awareness as well. If it's okay, just from an OT perspective, I wanted to add even some other ways we've kind of trying to do our best to adapt our environment, especially for any groups
I
that
was
might be
just
in
gonna
person.
say that.
Oh, thanks, Anna.
So I'm just gonna say that. So yeah, go ahead.
Oh, thank you. So in terms of our groups, what's great is we try to also offer a variability of what is accessible to those that want to join our groups as well. So we offer a mix of in-person, virtual. We'll also like rotate, sometimes offer both at the same time, depending what's available with our facilitators. And when it comes to our in-person groups, we'll do our best to try to adapt the environment and really consider those, sensory processing needs and differences in any way that we can. So some of the things we might do is we might really consider our lighting. So our lighting has become dimmable with our curtains and our light sources. We try to make it where there's a mix of if people prefer to write, especially if anyone might be nonverbal, then we have those writing options to communicate. We bring in if writing might not be an option, or if it's they prefer more technology, we have a smart board that we can use as well. We have a lot of different even sensory tools. So looking at our different sensory modalities, things like fidget items, hot and cold packs. I know for our mindfulness group, we also brought in a lot of great tools that can really help with, bringing that sense of calm and mindful peace. So things like, even like blankets and yoga mats and eye masks. So a mix of things, even weighted items that can help. And I think what's also very unique to our space is we also have two what we call sensory comfort rooms that allow someone to kind of step out and take a break if they need to help with regulation in any way that they need. And of course, we're so open that, if there is something that we didn't cover to make it more accessible, we want to do whatever we can to make it that it's more open and accessible to everyone as well. So I always wanted to let you know that we're considering the environmental needs as much as the physical needs and personal needs of each person's differences.
Yeah, doing the mindfulness groups in person was so fun. Having Domenica, because Jan and Domenica and I were all there, and just having this opportunity to say to everybody who came in the room, use anything you want here. And we had like a table of, all of the mood color glasses, everything, just a range of things. And and it's really important, I think, to show that everyone can explore these different tools, and then people learn from each other, and that it's okay. It's okay. I like having a baseball hat because I don't like the overhead lights, and that's the way I do it. Or whatever it is, everybody is totally accepted. And Braxton just put it beautifully earlier that you belong here in all the different ways you are. So yeah, really, really nice. By the way, we have like 1 million cool questions in the chat. I don't know if everybody's seen them. Want to make sure if we don't get an opportunity to answer them all today, will we have an opportunity to follow up? Because tons of questions in here, eh?
Yeah, what I can do is grab all the questions from the chat, send them to you guys after this, and then we can send the responses with the follow-up email if a format like that would work. Let's see how many we can get through. Thank you so much for that really comprehensive look at all the things that you're doing to support others and each other and yourselves. So let's start with what I caught as one of the early questions. Is ACT similar to radical acceptance theory? Sue, I saw you responding a little bit to that, so maybe you want to start there.
Oh, for sure. I'm very happy to talk about that. I've practiced with Tara Brach is the person who coined the term radical acceptance. And I've been doing, retreats with her for 30 years or something. So yeah, she basically brought this term radical acceptance, which is, I think, a theme, and ACT also uses a lot of these mindfulness things. It basically is coming out of Buddhism, right? Where the mindfulness tools all came out of. And so Tara Brach is referring to this radical acceptance of being this full-bodied, experiential, embodied acceptance of what's happening. And easier said than done, especially on sensory basis when we all have such different sensory processing needs. So for instance, with the mindfulness, when we are doing the exercises of paying attention in the present moment to the sensations as they are, for one person, that might cause a panic attack, right? There's so much fight, flight, or freeze and trauma, etc., all happening in the body. So we really need to have a wide range of tools to explore the present moment. And that is practicing acceptance. So where this tool of being with a sensation or a sense, we use sound, we use vision, whatever's available to the person, and using that tool of being in the moment and resting with and not fighting with, not judging. And there's a series of exercises and tools where you actually practice accepting the present moment through sensory experience. And then it's just making it accessible for people. But hope that speaks a bit about it. Radical acceptance is it's a big buzzword now, isn't it? But it's really the heart of it is, comes out of the mindfulness tools and Tara Brock's work on that. Yeah.
There's a lot of questions about how people can join the online mindfulness program or access these groups. I will also include links to like Tara Brock's kind of free online spaces as well, and people can start exploring different mindfulness modalities. But I understand that what you've done is special. So maybe you can just say how people can get involved. And there was a question around the necessity of a diagnosis. Can join these groups and what's the process of getting involved?
So maybe we can just clarify a couple of things. So there's actually two kind of partner organized or systems clinics working here, which is the Azrieli Centre and the Adult Neurodevelopmental Services. And one is like a research and program oriented center, and then the other one is more of like a clinical service. So to access ANS, actually, you do need a diagnosis of autism or intellectual disability. And so for things like our CBT group and probably ACT in the near future, a diagnosis is necessary. And then also you need like a physician referral and have to go through the process through Access CAMH. And then through the Azrieli Center, the different programs have different requirements on whether a diagnosis is needed or not. So some do and some don't, but it's kind of case by case or like group by group or program by program. And then there's usually a website, like the Azrieli website usually has like the requirements for different projects online listed. So yeah, and wait lists are long. Unfortunately, ACT is just starting out, so it's a little bit better. But for things like CBT, sometimes there's a really long wait list. I don't know if any of the mindfulness people wanted to speak about that.
Oh, well, Domenica and I and Jan were talking about getting the next group going. Like Jan was referring to, we just finished piloting because our program was all developed as a virtual program because that's the needs that autistic people were saying that they had at the time was like, let's do this virtually. And also we were just coming out of the pandemic. So, but so we're just looking at a time for the next group, right, Domenica? Now, Alex just pointed out the important thing is if you're going to do an ANS, Adult Neurodevelopmental Services group, you do have to have that diagnosis. And so keep in touch with us. We'll make sure that you have all of our info and we can let you know when groups are coming. But I know there's more questions and more time. But Alex put it well that diagnosis is needed.
Yeah, related to your online program, someone had a question about how confidentiality comes into play when people are accessing virtual groups via CAMH, where cameras are off, and there's not maybe safety around who might be in the room with the cameras off. How do you as facilitators hold space for people's needs? Are there explicit kind of conversations around people's comforts in virtual spaces?
Yeah, so actually one of the requirements for ANS groups is that we do have cameras on for confidentiality. So again, as a clinical service, we have less flexibility in terms of like the options that we can offer. We still, obviously we understand that people need to take breaks or something like that, but just like generally we have that as a requirement. So again, and things are different through Azrieli, but there is an understanding sometimes that some of the groups that they offer through Azrieli are not clinical services. And so there isn't the same, stringence around confidentiality and things like that. We, of course, ask everyone to keep things confidential, regardless of where we're offering it through, but there's different levels of control on that.
Exactly. And Alex already said it, but somebody asked the question further about no diagnosis. So, you know, the Azrieli Center is a research center. So there's all kinds of different research projects happening, and each one looks at different groups and different things. So some of the research projects are specific to intellectual disability, some of them specific to autism only, and then other things. So yeah, it's really project by project, but we can make sure that you get all this information.
Yeah, on the topic of research, there have been quite a few questions about, you know, how what you're talking about affects research. How do these ideas play into research? Specifically, someone asked with curiosity about how you work around the huge heterogeneity of doing research. How do you divide, sort, and range the range of sensory and cognitive issues and differences within the autism participant group's data when assessing if a treatment is available?
Yeah, I think a lot of our research projects are really in the early stages. Like with, I mean, mindfulness actually has been doing research with for a while, but ACT is very new. The CBT, the research that we're doing with CBT is very new as well. And so at this stage, it's more about like feasibility, right? Like how are autistic people that are in our groups finding the experience? It's not necessarily like, are we seeing, you know, these huge changes that we might expect later? Just because we're not at that stage in terms of like numbers yet. Yeah, you know, I do really see that as a problem because research kind of expects you to be very rigid and structured with your, you know, with your interventions. And at the same time, we want to be flexible and open. So I think our way of working with that in ACT and also to some extent in CBT is that the core processes are set, right? Like the main things we want to focus on in ACT are set. And then the way that we get to that has a lot of flexibility. So for example, we always talk about acceptance, we always talk about mindfulness, we always talk about values and committed actions in ACT, and then how we talk about it might change, and there are maybe 4 options for what we could do, but it still has that fidelity to that overall structure.
Yeah, a similarly entangled question is that how does the center or both these services tackle comorbidity? So for folks who don't know what comorbidity means, it means having multiple diagnoses at once. This person says it's a huge challenge already to modify autism-focused supports for a varied population, but then add on, it might be the only place where an autistic person feels safe seeking support about another condition that they may have, which feels like a huge logistical and support challenge, especially since carers may often be supporting patients with stress about conditions that the carers aren't experts in.
I feel like I've been speaking too much, but maybe I'll go again just to start, and others can jump in. I think again, this is obviously a really big issue as well. So, for example, for our group for CBT, it is only for people that are also in some way struggling with anxiety and depression, and so we don't tackle like a full range of co-occurring conditions in that group. And then sometimes, depending on level of need, we try to find resources in the community, or we refer people to individual therapy as well within our program. But for something like ACT, again, ACT is really not focused on a co-occurring condition, right? And it has that idea that like anyone, regardless of whether you're doing well, or you're struggling, or you are have diagnosed mental health or not, can benefit from this core psychological flexibility, right? That everyone can benefit from understanding your personal values and how to move towards your values. And so we're not actually targeting a co-occurring condition in ACT, and we're trying to help people with this general way of being that we believe will help across a range of co-occurring conditions.
I would say similar. I mean, we know that autism has many friends, and I know that Maxine and Daniel, who worked with us, you know, said, "Yay, you're on the A team," and you know, A team, they were referring to autism, anxiety, ADHD, and I mean, Jan, you noticed how many people in our groups shared these various other conditions. I mean, we've had people with psychosis, you know, who've had to do one-on-one sessions with talk about managing their voices along with their autism. But, you know, like Alex said, that the principles the purpose of the mindfulness, the neuro-affirming autism informed mindfulness, is to provide a way of engaging in mindfulness that's going to be individualized for you. So, and there's often multiple things, but it's yeah. So we're not specifically targeting the other. I never like the term comorbidity, right? But the other ways of being, the other things that are in our lives.
I
And
agree.
trauma too. Jonathan said, yeah, trauma. I mean, it's also got to be trauma affirming and trauma informed. It has to be. Yeah.
And that's why I always really like validation to be a big part of it. It's just being yeah, we've all had difficult experiences, and being but as you can see, I point out when people have shared experiences, and we validate people, because it's we want to always be trauma informed and always be acknowledging that yeah, that what people bring to the group and what past experiences they bring, and yeah, a lot of validation.
Yeah, I echo what someone said in the chat, that modeling and authenticity is also so important. And I think we've all done really, really cool work for those of us learning from you today. So thank you. I'll hand it over to you for some final words. I will pull all those questions that we didn't get to, hand them over to our presenters, and then I will be sending out an email full of resources, especially for those who couldn't hear us today. I'm so sorry about that. I hope your CC is telling you that I'm sorry. And the recording should be up in a few weeks. And as things come in, I will keep responding to them through that email. So thank you so much. And I'll hand it back to our presenters for a final few words.
Yeah, thanks so much for joining us, everyone. It was really great to share what we're doing, and to really be able to talk about all these different groups and sort of what it's like to provide them as this group of services, and be able to define each of them. It's really interesting for me too to hear about ACT and mindfulness too.
And thank you to PFLS for having us today. And thank you, Hannah, for really helping to put this all together and facilitating for us.
Thanks. And thanks so much to PFLS.